Bismillah ar-Rahman ar-Rahim. This is Dr. Sahar Khasheb, Community Medicine Department. I'm going to continue with you the prevention and control of the enteric or typhoid fever. And this is part 8. Prevention. How can we prevent the occurrence of typhoid fever before it occurs? So we apply general preventive measures for foodborne illnesses. So how can we eat our food to be sound and not harmful for us to eat? So if the food is raw or it is cooked, if it is cooked, it's passed through heat, so organism is killed. But a housefly could transmit the infection to my food. So prepared food should be covered. Raw vegetables or fruits should be washed very well. Food handlers should have, of course, certification for food handling. So educate food handlers about the importance of washing hands before any preparation of food, and this applies even to the mother in the house for preparing food for her family. Avoid recontamination of food that was prepared by coverage or putting in the fridge. Protecting prepared food against insects like nets and covers, and of course raw fruits and vegetables should be washed well before being eaten. The specific preventive measure is through immunization. Immunization does not give 100% protection from typhoid, but of course it definitely lowers the incidence and it shows the seriousness of the infection. It can be given at any age above 2 years old. Who are at risk to have the vaccine? Who are the candidates for vaccination? It is not routinely recommended to give typhoid fever immunization except in the following conditions. Those who live in highly endemic area with high endemicity, or those who are subjected to unusual occupational hazard like caring for hospital staff, caring for typhoid cases like doctors in the fever hospital, like microbiology lab technicians, as they are in contact with the Salmonella typhi itself during culturing and working with lab investigations. If you are a household with the contact of a carrier, so there is a carrier in the house, contacts of this carrier should take the immunization. Also, travelers who are traveling to endemic area, they should, if they can care for themselves, it's okay. If not, they should take the vaccination because they are exposed potentially to contaminated food and drinks. The best thing is to give them some advice not to eat any raw food except if they wash them by themselves and put some disinfecting chlorine or vinegar, and not to eat outside except cooked food and in good places that are trustable. Otherwise, they should be also vaccinated. There are 3 safe and effective types of typhoid vaccine are now licensed and available. So we have the live attenuated Ty21A vaccine, we have the unconjugated virulence antigen polysaccharide vaccine, and the third one is the typhoid conjugate vaccine or type bar TCV. The following table shows the characteristics of typhoid fever vaccines. So we have the three vaccines. The first one, the first column here, is the typhoid conjugate vaccine, and we call it conjugate because we conjugate it with tetanus toxoid, and it is the composition is 25 microgram of purified virulence capsular polysaccharide conjugated to tetanus toxoid. It is given intramuscular 1 dose, and of course it is in the form of a liquid, and it can be given to adults and children above 6 months of age to 45 years of age. So it is given those who are exposed and covers all the age of exposure. The unconjugated virulence polysaccharide, this is also 25 microgram of purified virulence capsular polysaccharide, but it is not conjugated. It is given intramuscular or subcutaneous, and it is in a liquid form, and it is given to adults and children above 2 years of age. That's why the typhoid conjugate vaccine is preferred, because it starts from 6 months of age. I can start to give it as a vaccination. The live attenuated Ty21A vaccine is 2 to 6 multiplied by 109 colony forming unit. This is the unit of measuring the ability of division of the bacteria. So it is called Ty21A attenuated, and it is attenuated typhoid type 2 strain of Salmonella typhi. It is given orally. It is just like capsules. There are either 4 or 3 in the packaging. It is usually 3, but in the United States and Canada they use the 4 doses, the 4 capsules, and it is given every second day alternatively. So and it is coated, enteric coated capsules. It's given orally, and the other it is given for adult and children older than the age of 6 years. The typhoid conjugate vaccine, or TCV, is preferred because it can given to all ages and improve immunologic properties and sustainability for younger children. Suitability for younger children, and gives longer duration of protection. It is used against typhoid, but no effective immunization for paratyphoid fever is available. However, it gives kind of some immunity. So oral Ty21A provides partial protection against paratyphoid B, but not like the protection given against Salmonella typhi. Control. How we have the case, and we need to control the situation. First, we have measures toward cases, measures towards the carriers, and measures toward contact of these cases. Measures toward cases. First, we must report to local health authorities. So how we are going to report, except if we have a case definition. So obligatory case report is in most countries. All health workers should be aware of the standard case definition. So it's either a probable or a confirmed case. So it's a probable or confirmed case. So how I am going to say this is a confirmed case? So it is a case that has the acute persistent fever for 38 degrees or more, lasting for more than 3 days, and 3 or more days, and with laboratory confirmed Salmonella typhi I cultured it from the blood or from the urine or from the stool or the bone marrow. I can find the Salmonella typhi. This is a confirmed case, or this case was clinically compatible, a clinically compatible case that is laboratory confirmed. So I have a clinical symptom the same, and this is compatible with one that was laboratory confirmed. Probable case, this is also when I will have fever for 3 days or more, 38 degrees or more, and lasting for 3 or more days, with positive serodiagnosis or antigen detection without the presence of the Salmonella typhi isolation, or it is linked to a case, a clinically compatible case. The case is the same, like that is epidemiologically linked to a confirmed case in an outbreak. So I have an outbreak and I have a confirmed case, and I have others who show the same clinical symptoms. I will call it a probable case. So the case should be isolated in a hospital, like fever hospital. However, home isolation is accepted if the house is hygienic and people are highly educated, and they will take very good care that the excreta of this patient are not going to be in contact with them, like they having water carriage system, soap and water for washing hands, this is okay. So, but why there is preference of being in the hospital? Because we want this patient to be under our supervision and released to the population and to in contact with others when he is completely safe. So release from supervision by local health authority is based on, so we have the health office or people who are making this surveillance for this patient will not release him from this surveillance except after 3 or more consecutive negative cultures of feces and urine. If the patient is having schistosomiasis, it must be 24 hours apart, 48 hours after stoppage of antibiotics, and not earlier than 1 month from the onset of the disease. If any of these 3 cultures was positive, cultures must be repeated monthly over 1 year, over 12 months, until I reach 3 monthly apart consecutive negative cultures are obtained. We must, of course, make the concurrent and terminal disinfection for feces and urine, of course, and articles soiled with patient's excreta. You know, the child, it could be a child, and this child could go into urination and defecation without feeling because he's ill, and this contaminates all the environment, so it must be concurrently and terminally disinfected. We use chlorine or hypochlorite for disinfection of urine stools or articles soiled with patient excreta. In communities with adequate sewage disposal system, water carriage system, the feces and urine are normally disposed through this system directly into the sewers without any preliminary disinfection needed. We give the specific treatment for the patients. We health education the patients because they are hazardous for those people around them. They must be completing their antibiotic for fear of relapse. They are, we must tell them the possibility of relapsing. This will encourage them to continue the treatment for 10 to 15 days according to the antibiotic under which they are taking, and that the organism could persist in their excretion and need for good personal hygiene to take care of people around. So he should also be cautious in preparing food. So as you see, carriers are the ultimate source of typhoid infection because they are between us. We don't know anything about them, and their urine and stool is full of the organism. So identification and treatment of carriers is one of the most radical ways of controlling typhoid fever. So carriers must be treated. So first, they are identified by culture or serological examination as being contact for a case, or they are regularly food handlers and in contact with food, so they should be examined serologically, and culture of urine and stool is routine for food handlers before issuing their cards for their health cards. So surveillance and work exclusion, if they are working with food handlers, they should be excluded until they are free and treated. If they are child care workers, and if some health care workers should be excluded from handling food, milk or water for others, and from providing patient care. Chronic carriers should be released from supervision and restriction of your occupation. They can go back to their work if they are food handlers. If 3 consecutive negative cultures are obtained from fecal specimens and urine, if they are from an endemic area for schistosomiasis, and they should be at least 1 month apart, and at least 48 hours after stoppage of antimicrobial therapy, Fresh stool specimens are better for than taking rectal swabs, and one of the 3 consecutive cultures should be taken from purgation. So at least one of the 3 consecutive negative stool specimens should be obtained by purging. Carriers should, of course, treatment, they take the same treatment, like cases, for maybe longer time. Health education by washing hands and soap and after defecation and urination and before the preparing of food are essential elements. Vaccination of household contacts of a carrier if the carrier is known. What are the control measures for contacts? So first, contacts of a case of typhoid, they should be health educated and not to encounter this infection. They should have routine vaccination, is not recommended generally. But in certain cases, if they continue to be household contacts with intimate exposure to a carrier, so if a husband and a wife or a mother and children, they should be vaccinated. So first, health education, not to encounter the infection from this patient, like not taking any food, not getting close to him until he is completely free, not getting in close contact with the case, and as we said, vaccination of people that we have inevitable contact, like husband and wife and like mother with children. They should be surveyed every day for occurrence of fever, and this is for the maximum incubation period to make sure that they did not have the infection from the index case. Food handling, family contact may be transient or permanent carriers, so we should take care. Household and close contacts should not be employed in sensitive occupation. If she's a mother, she should not be handling food for her family until she is completely free. So if a mother was a contact, that could be, we said she can be a permanent or temporary contact, should have at least 2 negative feces and urine cultures taken at least 24 hours apart have been obtained. That's why she can afterwards go to her activities normally. Good luck and thank you very much. Goodbye.